আসসালামু আলাইকুম ওয়া রাহমাতুল্লাহ। আজকে আমরা STI সেক্সুয়ালি ট্রান্সমিটেড ইনফেকশনস নিয়ে আলোচনা করব। সেক্সুয়ালি ট্রান্সমিটেড ইনফেকশনস আজকে আমরা ইন্ট্রোডাকশন এবং আউটলাইন নিয়ে আলোচনা করব। এরপরে আরেকটি লেকচারে ল্যাবরেটরি ডায়াগনোসিস ইন ডিটেইলস আলোচনা করা হবে। আমাদের লেসন প্ল্যানের মধ্যে আমরা যা রেখেছি, আন্ডারস্ট্যান্ডিং STI sexually transmitted infection and STD sexually transmitted diseases, একসময় এটাকে venereal disease বলা হয়। Prevalence of STI in the world, neighboring countries and Bangladesh, difference from other infectious disease, public significance and microbial etiology of STI, laboratory diagnosis, screening and checkup, management and prevention, and behavioral change communication role. প্রথমে আমরা কিছু পোস্টার দেখাবো সেই সময়ের ইম্পর্টেন্স বোঝানোর জন্য। 1936 থেকে 38 এর দিকে এই পোস্টারটা প্রেজেন্ট হয়েছিল। এখানে লেখা আছে, syphilis is a dangerous disease but it can be cured. অর্থাৎ মানুষকে চিকিৎসা নিতে আগ্রহী করার জন্য তখন পেনিসিলিনের আবিষ্কার হয়ে গিয়েছিল। Venereal disease can be cured, but there's no medicine for regret. এটা দেওয়া হয়েছিল যাতে সবাই এটাতে আক্রান্ত না হয়। এটি একটি সুন্দর পোস্টার। She may look clean, but spread syphilis and gonorrhea, and you can't beat the excess if you get venereal disease. চমৎকার পোস্টার একটি। 1 out of 4 college students has an sexually transmitted disease. Protect yourself by using a condom every time. It is a poster. Syphilis, false shame and fear may destroy your future. Have your blood tested. এই পোস্টারগুলো থেকে বোঝা গেল যে এক সময় এটা কত বেশি পাবলিক হেলথ ইম্পর্টেন্স বহন করত। এখন আমরা আসি STI versus STD. STI, sexually transmitted infections commonly spread by sex of any type. এটি WHO definition. STD, sexually transmitted diseases when STI present with clinical illness. And venereal disease, this was the previous name. This came from Venus. Venus was the love of goddess. So STI is a broader term which include all STD plus asymptomatic or mild form of STD. Situation in the world, 1.1 billion people, that is আমাদের বাংলায় বললে 110 কোটি infected by any STI, of which 500 million from syphilis, gonorrhea, chlamydia, and trichomoniasis. And genital herpes is present in 550 million. 290 million women, they are infected by human papillomavirus. And there are human papillomavirus related cervical cancer in 530,000, of which 275,000 die. In 2015, 108,000 people died from STI, different types, and more than 1 million new STI every day. প্রতিদিন more than 1 million, 10 লাখের বেশি STI আক্রান্ত হয়। এবং তাদের মধ্যে more than 50% are 15 to 24 years. আমরা আরো বলতে পারি প্রতি বছর 340 মিলিয়ন নতুন কেসেস অফ কিউরেটিভ STI, যা চিকিৎসাযোগ্য STI আক্রান্ত হয়, and 75 to 85% of those new cases are in developing countries. 10% adults newly infected with curable STI. 12 million new cases of syphilis, 62 million new cases of gonorrhea, 90 million new cases of chlamydia. এখন কিন্তু chlamydia বা non-gonococcal urethritis much more common than gonorrhea. 176 million new cases of trichomoniasis. What about the USA prevalence? USA প্রসঙ্গটা আমরা এজন্য আনলাম, তারা স্ট্যাটিস্টিক্স খুব ভালো ইউজ করে এবং সব খোঁজ খবর রাখে। 20 million of USA people newly infected and 100 million new plus old cases. 33% of US girl has chlamydia infection, and this is most common STI in USA. 16 billion direct cost. 25 to 40% of US teenagers had STI. আমরা দেখেন প্রায় অর্ধেকের কাছাকাছি, অর্থাৎ এটা একটি মারাত্মক সমস্যা। 8 common STI diseases in USA are chlamydia, gonorrhea, hepatitis B, herpes simplex virus 2, human papillomavirus, syphilis, and trichomoniasis. What about our neighboring country, India? Prevalence of suggestive symptoms of STI in India, in case of women, 23 to 43%, near about USA. In case of men, 4 to 9%. That means men may remain asymptomatic. Most of the men population are asymptomatic. STI clinic data from India for men indicates that syphilis 12.6 to 57%, chlamydia 20 to 30%, chancroid 9.9 to 34%, and gonorrhea 8.5 to 23%. Overall prevalence of STI among adults is 6% in India. Now we come to our Bangladesh situation. From a Chittagong Medical College study among 30,000 patients, non-gonococcal urethritis was found in 31% cases, gonorrhea 27%, syphilis 18%, and genital herpes 4.8%. Genital herpes is comparatively less in this region because of hygienic things. In a Dhaka hotel-based commercially sex workers study, non-gonococcal urethritis was found 43%, gonorrhea 35%, syphilis 8.5%, genital herpes 34%. So overall picture of Bangladesh, non-gonococcal urethritis, that is chlamydia 47%, gonorrhea 39%, genital herpes 34%, and syphilis 12%. So syphilis is much less than gonorrhea and non-gonococcal urethritis. Factors contributing to STI spread: human behavior, lack of awareness to healthcare, lack of awareness about STI, migrating population, healthcare providers not adequately trained, poor medical services, hygiene and environmental factors, hormonal and other factors. Salient features of STI. First, number one salient feature is it spreads by sexual route mainly, not only. Some STI are restricted to genital organs only, like gonorrhea, syphilis. Some are curable and vaccine preventable, like HPV vaccine. Some may spread to other organs, some may be generalized, some of them may lead to infertility. Some may cause carcinoma, like cervical carcinoma, hepatocellular carcinoma. Some of the STI may lead to immunodeficiency, for example, AIDS, acquired immunodeficiency syndrome. And may cause chronic pain, and ultimately some of the STI can cause death. Moreover, a large proportion of STI population remain as asymptomatic. High risk groups. Adolescent boys and girls are very high risk groups, and women who have multiple partners, they may be commercial sex workers or like that, sex workers and their clients, men and women who has to stay away from families for a long time, men having sex with men, partners of various high risk groups, street children, etc. Microbial etiology of STI. STI may be caused by bacterial, viral, protozoal, fungal, parasitic. All types of microbes can cause STI. And common STI are, in case of male and female, gonorrhea, chlamydia, syphilis, chancroid, genital herpes, lymphogranuloma venereum, trichomonas vaginalis, genital wart, candidiasis, HIV, hepatitis B virus, scabies, pubic lice, and molluscum contagiosum. These are present both in male and female. Only in female, pelvic inflammatory disease and bacterial vaginosis, and in case of male, epididymitis and orchitis. Symptoms and signs also varies in case of man and woman. In case of man, it may be manifested as urethral discharge, burning or pain during micturition and urination, genital itching, inguinal swelling or scrotal swelling, blister or ulcer on the genitalia, itching or tingling in the genital area, warts on genitals, anus or surrounding area, and generalized symptoms like fever, body ache, muscle ache, jaundice. In case of women, unusual vaginal discharge, genital itching, dyspareunia, lower abdominal pain, burning micturition, fever, body ache, muscle pain, and jaundice. In case of, how can we classify STI? There are many bases for classification of STI according to causative organism. It can be bacterial, viral, protozoal, according to mode of transmission, according to the most common presenting symptoms. So let us examine. According to the causative organism, bacterial, viral, protozoal, fungal, and mixed infection. Bacterial common, gonorrhea, chlamydia, syphilis. Among the viral, herpes, HPV, HIV, protozoal trichomonas, fungal candidiasis, and a mixed PID and epididymitis. According to modes of transmission, maybe endogenous infection, yeast infection and vaginosis, sexually transmitted infections, gonorrhea, chlamydia, syphilis, and others. Iatrogenic infection, PID following abortion or transcervical procedure. Complications varies in case of men and women. In case of men, urethral structure, phimosis, paraphimosis, disfigurement of genitals, infertility, cardiovascular complication like syphilis and neurosyphilis. In case of women, most important is pelvic inflammatory disease that can lead to infertility, ectopic pregnancy, spontaneous abortion, stillbirth, cervical cancer, and chronic pelvic pain. Complications in case of neonates, congenital eye infections like syphilis, chlamydia, gonorrhea, sepsis, arthritis, meningitis, mental retardation. These are the complications in case of neonates. Systemic infection, the STI may lead to systemic infection like proctitis, proctocolitis, acute membrane glomerulonephritis, tabes dorsalis, myocarditis, aortitis, iritis, choroidoretinitis, musculoskeletal osteomyelitis, arthritis, etc. And it can also lead to septicemia. Factors increasing the risk of transmission. Biological factor is sex, immune status. Behavioral factor, personal sexual behavior, other non-sexual personal behavior, even without any risk behavior. Social Status of the women in the society, sexual violence, child marriages, these are also increasing risk factors. Why women are at higher risk? Biological differences, the thin lining of vaginal mucosa, larger exposed area, genital fluids stay in contact for longer time, young women, immature genital tract, and symptoms are less reliable indicator. All these biological differences made the women at a higher risk. Use of vaginal douches is another risk factor, and different socio-cultural norms for men and women. So STI is a public health problem, and this is a major cause of ill health in the country, cause serious complications in men and women, increases the risk of HIV transmission, responsible for reproductive loss, increases cost to the health system. Lab diagnosis and screening, why and when, why it is required and when required. First, for confirmation of diagnosis, after clinical diagnosis, we need to confirm it by laboratory test. Screening of asymptomatic or mild infection, it is clear. Checkup of prospective sexual partner, when prevalence is more in the society, then every male or female have the right to check his partner for any STI. Checkup of before and during pregnancy, this is routinely done in our country, and everybody is advised for VDRL, RTI, hepatitis B, C, as a part of the antenatal checkup. Checkup after birth is also required. Checkup before blood and organ transplantation. This is a routine practice in our country. All the blood are screened for this STI and some other blood-borne infections. And it is also required for epidemiological surveillance. And common sites for STI, you see from the male and female anatomy, these are the sites from lower side to upper side, vulva, labia, vagina, vagina, cervix, uterus, fallopian tubes. In case of male, penis, genital ulcer, syphilis, epididymis, urethra, spermatic cord. These are the sites. Transmission of STI. This is transmitted only by sexual route, but sexual route may consist of genital, anal, genital, oral, genital, or normal and abnormal sexual behaviors both included. Skin to skin contact, kissing, non-protective sex, body rubbing can cause transmission of STI. Mixture of infectious body fluids, blood, semen, vaginal secretion, sharing of needle and other drug and needle-stick injuries from a pregnant woman to her unborn fetus or to infants during vaginal delivery or through breast milk. Infestation like scabies and pubic lice can also be transmitted through shared clothing, bleeding, bedding, linen, etc. Chance of transmission of unprotected after vaginal sex. In case of chlamydia, it is equal to both men and women. But in case of gonorrhea, chance of getting the infection is 2 times more than the men, 22 versus 47, more than 2 times. HPV also similar chances. Hepatitis B, women 50 to 70%, men we do not know. HIV, women are greater risk than the men. Approaches to STI management, there are 3 types of approach: traditional or clinical approach, syndromic approach, and traditional approach has got some limitation. Diagnosis is often incorrect or incomplete. More than one STI is often present at the same time, and asymptomatic infection could not be diagnosed. Lab-assisted approach advantages exact diagnosis using laboratory test, avoids over and under treatment, wrong treatment, may avoid antibiotic resistance, avoid negative consequences. Asymptomatic infections can also be detected. Lab-assisted approach has got some limitations. It is expensive. Trained laboratory technicians are needed. Infrastructure and supplies are needed. patient must return for test result, patient must wait for treatment. Syndromic approachment is a popular method. Here, diagnosis is based on the identification of syndrome, which are combination of the symptom the client reports and the signs the healthcare provider observes. This is the provision of the most effective therapy at patient's first contact with a health or medical facility. The recommended treatments are effective for all the diseases that could cause the identified syndrome. Provide single dose treatment as far as possible, comprehensive to include patient education on risk reduction, counseling, condom promotion and provision, partner notification, and follow-up. All these are included in the syndromic approach management. So syndromic approach management has advantages. It is very fast. Patient is diagnosed and treated in one visit. Highly effective for most of the syndromes. Relatively inexpensive since it avoids use of laboratory. No need for patient to return for lab results. All possible STI are treated at once. Scientifically tested in many parts of the world. Easy for health workers to learn and practice for patients. Integrated into primary healthcare services more easily. Can be used by providers at all levels. There are some limitations of syndromic management, not useful in asymptomatic individuals. Over-treatment in patient with one STI that causes the syndrome, financial cost of over-treatment and side effect, increases potential for antibiotic resistance, especially if full course not completed. Not effective in some cases, such as vaginal discharge. The syndromes are urethral discharge, vaginal discharge, genital ulcer, non-herpetic, genital ulcer herpetic, lower abdominal pain, inguinal bubo, and scrotal swelling. These are the syndromes by which a patient can approach. So this is all about introduction and outline of sexually transmitted infections. If you like it, please subscribe this channel. Thanks for watching.